Hello everyone, and welcome to today's show. My name is Savannah Sellers. I am an NBC News correspondent, and I have been doing this show every day at 1 p.m. Eastern live to give you the coronavirus updates that you need, but also tell you some stories that you want to hear. I just want to make sure that you are informed but not overwhelmed. That's what I say every day, and I also try to give you guys something to smile about, and I will always try to start with good news. Also today, I have an announcement at the top of this, which is that I will be going live again today at 3 p.m. Eastern, so in 2 hours from right now, with the one, the only Mr. Al Roker to talk about Earth Day and sort of how coronavirus has actually had this impact on the Earth. We're seeing less air pollution and things like that, but is it temporary? What's going to happen? And it's important to remember, even in the middle of all of this, that this is in fact Earth Day. So we should talk about it. So at 3 p.m., Al Roker and I will be back here live. So tune in again at 3 p.m. It's my first time going live twice in one day. Also, somebody says, Happy Quarantine Wednesday from San Diego. That's where I'm from. Hello. All right, so in the vein of starting, in the interest of starting with some good news, one of the big things that somebody says, love Al Roker. So do I. Who doesn't? And I'm so excited to talk to him later. But one of the things that we talked about yesterday that has been one of the main questions that I'm getting about is all about this small business loan program. So some good news is that the Senate did pass nearly $500 billion more that is going to be put into that small business loan program, as well as help out hospitals, some in rural areas also, and those businesses are going to focus on businesses in rural areas and women-led businesses. So that's good news, and for those of you who have been asking questions about that, hopefully that makes it a little bit easier for you to get through that application and approval process to get a small business loan. But anyway, keep messaging me. I'm at Watch Savannah with any questions or thoughts about that, because I know that's been a big one that we've been talking about a lot. One of the other things that I just think is kind of a cool thing to update on is you guys probably remember that I showed you this, and you've probably just been seeing it on the news. This was when the USNS Comfort was coming in to New York City. There it is, of course, with the Statue of Liberty. This was that naval ship that was coming in to assist with coronavirus medical help, to basically be an overflow for beds and have these additional doctors and nurses that were on board. It is actually going to leave in coming days because Governor Cuomo, the governor of New York, let President Trump know yesterday when they met that it is no longer needed. So it's going to be departing New York City in the coming days and return to its base in Virginia. One of the other big things about where we're at today that I know is a little bit scary, but it's something that is, one of those topics of conversation right now, and it is the idea of a second wave. I also know a lot of you guys have been sending me questions about, could this come back? Yesterday on here we talked about, is it going to come back like the flu or go away like SARS, that type of thing. So some not great news, but something again we should talk about is that we do have health experts that are estimating that this next wave coming in next fall or next winter, they are presuming, that's what their research is showing them, could be even worse than this first wave, because it would be coupled with the seasonal flu. Now, we had a little bit of that this year, but if you think about the timing of when this really hit the United States in February, which we'll also talk about in a minute when it did really hit the United States, but because we started in February, we sort of missed that fall and beginning of winter flu season, that portion of the flu season. It wasn't really here for the entire flu season. So now that coronavirus is here and we are battling it in the fall and winter as we're sort of leading into flu season, some experts are saying that could make it worse, to be these two things to be coupled together for the duration of that season. Someone here is saying, everyone get your flu shots in October, please. That is a great thing to note. We also think the good news though, and one of the White House coronavirus task force members, Dr. Deborah Birx, had said that hopefully though by then we will have more of an antiviral treatment. There will be ways to actually treat coronavirus, and that then hopefully that means that we can sort of curb it a little bit more. We will of course be more prepared, having been through this right now. She also had said that she doesn't necessarily think that it will be worse because this is pretty bad right now, and she pointed to how bad it is in New York City. So all of that seems to, leads to some confusion. Is it going to be worse? Is it going to be not? And I know what's really frustrating about a lot of this is that it's confusing. But the second wave is something important to talk about and to keep in mind. One of the other things that's going on right now that we've been talking a lot about here is what are treatments? What is possible? People have been asking questions about this. So there's been this one drug in question that a lot has been discussed because the president was talking about it quite a bit. So it's this drug called hydroxychloroquine. It is normally used to treat malaria. So it is a drug that is used for something. It's not, new. But it's been used to treat malaria, and the question about it has been, is it also effective in treating COVID-19? There was what Dr. Anthony Fauci, the nation's top infectious diseases expert, had called anecdotal evidence about it being effective, but the meaning that it wasn't part of a bigger study. So the nation's top infectious diseases expert had said it was only anecdotal, that it was helping some people, and there was sort of this debate going on, should we be prescribing it, should we not? It was being prescribed in conjunction with a Z-Pak a lot. Well, they've been doing a study on it, and according to that study, the new information that we have, it did not find the drug to be effective. So these veterans hospitals, VA hospitals, were using it to treat some patients. It not only did not seem to be effective in this study, but they also found that people who were prescribed it actually had a higher mortality rate. Now, that's not necessarily to say that this drug contributed to that, but it just might mean, that it really didn't bring anything down. But that's one of the big questions is, when are we going to find a treatment? What is going to be effective? That's been one of the ones that's been on the table, and it's not looking to be effective. It does not seem like it is one of the viable treatment options. So other things are happening, like vaccine testing and all these other things, but there's one of them. Some stuff that you guys might need to know for yourself. There's at-home testing. This is something that I brought up this week on this show, and it could hopefully be some good news as far as more tests being able to get done, getting results faster, that type of thing. So this first at-home test was approved by the FDA using its emergency powers. So they are basically approving things faster than they normally do to try to help out with this. It's a nasal swab, so it is one of those ones where you have to put something in your nose, but what's good about this is that if you're doing it yourself, then it means that a healthcare professional is not having to get, in close proximity to someone who's potentially positive for the virus. So that's good news, that it is lessening the exposure for healthcare professionals. So you collect your sample at home, and it's by this company LabCorp. And to qualify to get it, though, you have to fill out a questionnaire on the LabCorp website. So some people were asking, how can you get that? That's how you're going to get it. But first, it's available for healthcare workers and first responders, but they are saying that over the next several weeks, it should become more available to the public, and especially become available to people who are showing symptoms. So if you're showing symptoms and you think you might have it, that's where you can go, is the LabCorp website, to fill out this questionnaire. But right now, initially, as they're just beginning to be produced, this is especially for healthcare workers and first responders. But the way it'll work is you swab yourself at home, and then, so it gets overnighted to you if you're approved. Then you swab yourself at home, your sample is sent to a lab, and you should have the results within 1 to 2 days, which is a pretty quick turnaround. Somebody's writing it in there for me, LabCorp website. Thank you, Barb. So that's something that you guys might need to know. Then the other big news today, and something that we've been having a lot of questions about, is antibodies and if you're immune. And so I just want to talk about these two big pieces of information that have come out of these studies regarding antibodies, and then also deaths in the US. So let's start with deaths to get through that. We first thought that the first death in the United States was February 29th in Washington State. That was thought to be the first death. Well, now it's turned out that there were at least 2 other deaths in the US that were before that and were earlier than believed. So this was here earlier and had killed people earlier than we knew. 2 people in California, one on February 6th and one on February 17th, had died, and it wasn't believed at the time to be related to COVID-19. But further testing later, after they have passed away, revealed that it was related to COVID-19. So again, that's February 6th and February 17th. And we had initially, or up until this point, we had thought that the first death was February 29th. And we thought it was in Washington State, and really it was in California. Then on the antibody testing, I just think these numbers are pretty crazy. And I just thought it was something that we could sort of talk about in here. I want to hear what you guys think about this. So there's been these studies going on where they are doing antibody testing on a select group of a population that is supposed to be representative of the population of that area. One of them was happening in Los Angeles. USC was doing this study. This study, where they're taking blood from somebody and determining if you have antibodies or not, that's how it worked, estimates that 4% of Los Angeles County residents have COVID-19 antibodies. So that means that they either had an active infection, they were sick, they knew it, or they were sick and they thought that they had COVID-19 but maybe couldn't get tested, or they have recovered and you might have never even known that you had it. You could have been asymptomatic. So 4% of Los Angeles County residents either have an active infection or have recovered from one, meaning that you now have antibodies. So what that figure translates to is about 320,000 people in the county at the time of this study being completed. That's far, far higher than the actual number of positive COVID-19 tests, which was about 8,000 at the time that this research was conducted in early April. So let me just repeat those numbers. 8,000 people were confirmed to have had it, were tested, and were positive. But this study is saying that at that same time, what they're seeing from these antibody tests, 320,000 people in LA County probably had it. I mean, that is a huge difference. And I just think it's pretty startling to think about how many people we don't know who actually have the coronavirus. I think in some ways, maybe it's good news that a lot of people had it who had no idea that they had it. So, they were okay throughout the whole time. And also a bigger number means we're closer to herd immunity. So let's talk about that. Hopefully closer to herd immunity. So the question really about antibodies in general is, are you immune or are you not? We don't know that right now, and we don't know exactly when we will know that. So experts suspect that people who've had the coronavirus can't immediately become affected a second time, but it's unclear how long that protection lasts. So the initial findings aren't going to identify which people are immune, because a positive result from an antibody test can't be considered just this get out of jail free card. You're fine, you can't get it again, you're not gonna get it, you won't get super sick. We just don't know. Only time, and they say maybe even a year or more, according to experts, will be able to determine whether immunity lasts several weeks, several months, several years, or potentially even a lifetime. So I just thought that was some information to talk about here. I'm seeing people that are sort of saying like, wow, what's going on? Anyway, I will take any questions that you guys have, so feel free to start sending those in. And while I do that, while you guys start to do that, and while I sort of find some questions, I'm going to give you something to smile about. I try to do this every day, and I think that this is a really good one. So this guy right here, you can see these two pictures of the same person, but specifically in different sort of uniforms and looks. His name is Eric Nansel. He's a lieutenant for a fire department in Massachusetts. That's him over here, duty as a fireman in Massachusetts, as a lieutenant there. On his days off from being at the fire station, he is working on the front lines as a respiratory therapist and an ECMO therapist. That's that machine that the ECMO is where it sort of takes your blood out and then oxygenates it if you're having trouble breathing and then puts it back into you. This guy, he's a firefighter. That's his normal job. And then on his days off, he's going and being a frontline worker as a respiratory therapist and an ECMO therapist. He is, as his wife said, a double hero. That's what she called him, which I just love, and it's so true. I mean, how cool is that? Are you kidding me? He's doing both of those things, serving his community and putting himself at risk in both of those ways, being on the front line in those two jobs. I just love that. Okay, let's take some questions. I was seeing a couple. Let's see. If you think you had it and beat it without testing. Okay, so there's a lot of questions coming in here about how to get tested for antibodies. Right now, this has only been being done in these small groups. So the main thing has been those numbers that I was just referencing were people who were part of a study, and they were selected specifically so that they could be representative of the bigger population. So then the people who were, pulled for it were supposed to be, reflective of what the population looks like. So it wasn't just that anyone could get it. The hope is that that is going to be rolled out more. That is one of the big things that we think that we need in order to reopen, is to understand who has antibodies and who doesn't. But again, the big question is about the fact that we need to understand what it even means for immunity. You know what I mean? And I see people are also here asking about how about before donating plasma. So plasma, that's a great question, because, and another one, what about plasma therapy? So this plasma therapy idea is that somebody who has had COVID-19, whether they knew it or not, and has antibodies, then their plasma could be used as a treatment. I think that's what you guys are talking about, if you want to respond in real time and let me know if that's what you mean. That is one of the most important things for people to be able to determine if you are going to be able to donate your plasma and have it be helpful, would be to know if you have had the virus or not and if you have had antibodies. So what they're also asking is right now people who have had COVID-19 and they knew they had it. That's where this question is coming in, and that's exactly sort of what we're getting at with when are we going to ramp up testing. So right now, if you were sick and you knew you were sick, you got tested, you were positive, you fully had coronavirus and were aware of it, or even let's say you didn't have symptoms, you were asymptomatic, but you got tested maybe because a household member had COVID-19, so then you were tested. All of those people who know because they've been tested and are positive, is something that medical professionals are asking those people to do, is to donate their plasma for it to potentially be used as therapy, where then basically people who are sick and at the beginning of sick, they've just identified it, are given these antibodies so that it can help them fight it off. We are hoping that that is going to become an effective way of treating people, one of those many ways, just like we looked into hydroxychloroquine, but it doesn't appear to be effective according to this most recent study. So plasma therapy is hopefully going to happen. If you were never sick, and I think this is where you're getting what about before plasma therapy, if you were never sick, maybe you were asymptomatic, or maybe you even were sick but you didn't get tested, if you've never known that you had this positive result on a COVID-19 test, right now they wouldn't necessarily know that they want your plasma. That is exactly where that antibody testing will come into play, but that's not available in a widespread way right now. So that's one of the things that they are working on ramping up. It's one of the things that the governor of New York and President Trump talked about yesterday. So hopefully we will see more of that available soon. All right, I think that was most of the questions today was about antibodies. Somebody says, is this news right that a second wave of COVID-19 is going to come? Yes, that's one of the things that we talked about in the beginning of this. Experts do believe that it is, and we are concerned it could be even worse than the first, because if it comes in the fall and winter, that means that we would have it for the whole of flu season, which is not exactly what happened this year, because it sort of arrived here in the United States in the middle of flu season, rather than us having the whole flu season to be dealing with both the flu and coronavirus. Somebody also noted on here that means it's very important to get your flu shot, which is a really good idea. Somebody says, should you still check your temperature if you might be asymptomatic? If you're asymptomatic, it probably doesn't mean, it means that you probably don't have a fever. So checking your temperature isn't going to reveal to you if you have COVID-19. But, I think right now it's a good idea to be checking your temperature no matter what, especially if you're just concerned about, going out, if you're going to the grocery store, potentially infecting other people. It's always, a helpful indicator, and we don't have very many of them right now, but knowing your temperature is helpful. But if you're asymptomatic, you probably wouldn't have a fever, so that would not necessarily be helpful in determining. All right, you guys. Somebody also just asked about vaccine. Do we know if the vaccine will be a one-time treatment? That is a great question, and we do not know yet, because we don't know a lot about it because it's just in trials right now. But the good news on that is that it was announced last week that people, all these different private companies and government research centers that are working on a vaccine are now going to be working together. So there's sort of this coalition of companies that are working on developing a vaccine, which is great news because it means that they're sharing their information with each other, working off of each other. We have now had 2 vaccines that have actually been tested. You might remember it's actually been a couple of weeks now, maybe even close to a month, that the first vaccine was tested on a human in Washington State. and Johnson & Johnson had mentioned that they were going to be hopefully testing by September, but now that they're all working together, hopefully that means that we will have more news on that. Somebody asked about chloroquine working. According to this latest study that was done at VA hospitals, it was not effective, and the subjects who were actually given the hydroxychloroquine were actually had a higher death rate. There was a higher mortality rate among those people. So it does not seem like it's actually working. All right, you guys, been talking for a while. I always say that about this point when it's when I've been on here for about 20 minutes. Thank you so much for tuning in. Somebody asked, when will we see if the protests results in spikes in their communities? That's a good question, and it's something that we talked about this week. For those of you who weren't watching or didn't hear about this, there's been these protests going on in various states at state capitals about ending the stay-at-home order. Many of those people who were there were not following social distancing. The plan for some of those initially was that you would just go by and honk in your car, and that would be your way of protesting. Well, they got out of their cars, and they were near each other, and they were not wearing masks. They were certainly closer than 6 feet. So the question is, when will we know if those people potentially got infected? It's taking the course of this virus is basically, those 14 days. It's really going to determine if you have it or not. I think one of the good indicators of something like that would be that I just said yesterday that we found out that 7 people so far have been infected with COVID-19 that was related to voting in person in the Wisconsin primary. If you remember that they did not actually delay the vote, which was what the governor had tried to do by executive order. Didn't end up happening. The state Supreme Court struck that down. Their primary did go on. We saw lines that were blocks long. 7 people so far have been confirmed to have had the coronavirus from that, 1 poll worker and 6 people who went to vote. So it took us a little time to see that. So that's probably would be about the same thing from those protests, but we will see. Anyway, thank you guys for watching. This is here live every day at 1 p.m. Eastern. My name is Savannah Sellers. On Instagram, I'm at Watch Savannah. You guys can send me questions there. I've been taking a lot of, what I talk about from those questions, which has been really fun. I'm happy to, of course, be giving you guys the information that you do want. But then the other thing is today, I'm not very good at math. In about an hour and 38 minutes, there we go. At 3 p.m. Eastern, I will be live right here again with Al Roker. Who doesn't love Al Roker? Come back here at 3 p.m. Eastern. I will be live with him to talk about Earth Day. That is today. I know that there's so much going on. It's tough to remember things like that, but today is in fact Earth Day. And Al and I will be here at 3 p.m. to talk about his reporting on how coronavirus and us all being locked down at home has actually helped pollution, but is it going to stay that way? And what does that mean? And what have been the benefits for now? So 3 p.m. with Al Roker, 3 p.m. Eastern, but then every day for the rest of the week, 1 p.m. Eastern, I will be back here with this coronavirus news updates show. Thank you guys for watching. Thank you for your questions. Again, I'm at Watch Savannah. Find me there and send me questions. I love talking with you guys, answering your questions, and helping you figure out, how to navigate this time, because it's scary for all of us. So I'm happy to do that. Stay safe, stay healthy. Thinking about you guys. See you in an hour and a half, 3 p.m. with Al, and tomorrow at 1 p.m. Eastern for our usual. See you guys later.